Hi, I'm Dr. Elizabeth Coyne and I'm just going to go through A3 for 2806 Evidence-Based Nursing. Now this assignment is 1,500 words and it's really wanting you to have a critical evaluation of one research article. It's 50% and it's marked out of 50. It's during week 11, but make sure you start working on this throughout the tutorials and just building on it. This is where 50% of your marks. It does look like it could be an easy assignment, but it's the depth of the analysis that you provide that will get you the marks. So the aim on this assignment is to really build on the skills from A2, the annotated bibliography, to really build your knowledge and ability as a clinician to critically evaluate a research article. And so use your feedback from A2 and then really build on your ability to evaluate the quality and relevance of research to your clinical practice area. So the task description in particular is really wanting you to make a critical evaluation report. So you have to really identify and explain the different elements of the research article in your assessment item. You need to critically evaluate these and use supporting evidence to justify why you're sort of giving it that evaluation, and then discuss significant implications of this research for your practice. So you will need 10 references. So you'll have the one that is the article provided, and then you need to have 9 other references. So this is the article that we're using, which is a very nice mixed method research article, which has got both surveys and qualitative aspects to it. It's also about chronic disease and health literacy, which is a really sort of great clinical topic for your future clinical placement. So the first part is just to really break it down as we did in tutorial 2. What is the population? What is the problem? The intervention, the comparators, the primary outcomes and the secondary outcomes. So what are secondary outcomes? These are maybe the longer term things. And so a primary outcome, if you looked at a primary outcome, it may be to understand the self-management ability of a particular population of people. The secondary outcome would be that their ability to self-manage more at home would reduce their readmissions. So you'll find this written in that journal article. So the next areas are looking at the actual authors, and so this is an overview of the actual journal. Is it a good journal? Have a look, and don't spend too much time on this, remembering your word count. This just needs to have a brief saying this is a good quality journal. These authors are lead in their field, and this is identified by several journal articles by the same authors. And this article is useful because it relates to my clinical practice and my ability to identify the health literacy levels of my clients. Look at then the abstract and the title and the literature review. Is it leading you in? Is it relevant? What is in that abstract information? Were the aims and the actual objectives of the research identified in there, and was it the literature, did it flow from big picture down to actually the significance and the problem that they're looking at? So again, this is actually really small in writing, but hopefully you have your actual outcome, your research article there. So this looks at, what type of design, what was the research question, and identify this. This is maybe in the background or it may be in the method section. Identify the study and why was it needed, so the significance. Describe the interventions if they were used, what they were and why. Then look at the sample, the population, the setting, the context of the setting, how they recruited, and how they were accessed. Was there any different ethical issues in relation to this particular population? Was ethics obtained, and was this clearly provided? And did they, highlight any risk factors with the population? The data collection. What was actually collected and why? And what were the outcomes and the measures? Also look at the tools. Were they validated or non-validated surveys? Did they have a survey interview questions, and were they based from literature or were they just developed? Was it open-ended or were they semi-structured questions? And look at sort of, was the bias with the researcher? Was their bias identified? Was there a risk of bias? Was it, a academic interviewing students where there may have been a risk of bias? In the data analysis, look at what statistical methods they used and were they appropriate. Were they appropriate for these number of sample size, for the surveys completed? How were the quantitative results reported, and how were the qualitative results reported? Summarise the researcher's findings in your own words. This is really important. Was this research, the research question answered in the actual process of this study, and justify? Were suggestions for further research made, and why, and was this important? And then really look at this relevance to nursing practice. So critically evaluate and reference sort of how this was relevant. So look at important things to include. Was the patient values included? Was this useful for patients? Will they accept it? Will it be something that will improve patient outcomes? Is there clinical expertise included in this, and was it useful then to sort of for your own practice? Will this change the way we practice? Is there evidence to support that? And then, what other evidence exists for this particular problem? Is this being a well-researched area or not? So this is the suggested workout. Again, it just allows you to start the flow. You do not need to have it exactly because you will have some areas which may take a few more words and others which will take less. But just remembering that it is building throughout, because when you look at your marks, this is again how your marks are set up across these particular word counts. And so making sure that you include your reference list at the end, but it's not included in your word count. So question, how many references do you need? You need 10 overall. 1 is the actual article that you're breaking down. Why do you need the other ones? This is that justification, identifying the relevance, looking at this particular research topic and supporting that their recommendations make sense. So overall, start to read the article and highlight the information. This is a really important step that any researcher does as they critically analyse a research article. They read it fully once, and then you start to highlight different sections, looking for what is important, looking for the sample, the setting, the method, what are limitations, the measures they use, was the researcher biased, and all of this information is written in that article. You just need to find it. So look for also your supporting research to justify and support your answers. So why was a sample of 10 okay for a qualitative method? Why was a survey with this particular aspect a good survey to use on this concept? This is where you'll get your supporting research and evidence and references from. And make sure as you write up the information, ensure that it flows. So this is just a brief overview of A3. We will be covering this in shoots 4 and 5. So it's really important to come so that when we're practicing on the articles in the tutorials that you start to learn how to do this. Any questions in Teams? Thank you.